Doctors treated more infectious ailments in 1904 than they do today. In the absence of antiseptics, antibiotics, or penicillin, doctors of the late 19th and early 20th centuries had to treat ailments like typhoid, cholera, smallpox, tuberculosis, and measles. Maladies like pneumonia, dysentery, and postpartum infection could prove fatal, the product of an incomplete understanding of what caused ailments and an even vaguer knowledge of how to cure them. Pneumonia was a common occurrence during the winter months. As early doctors did not understand the existence of bacteria, they blamed the illness on exposure to a chill, dampness, or night air. In the absence of antibiotics, there was little a doctor could do than to isolate the patient, the same treatment he would use for typhoid, measles, smallpox, influenza, or tuberculosis. Bacteria in tainted water, a product of poor human waste disposal, led to a variety of illnesses that had diarrhea or dysentery as the principal symptom. With doctors unable to replace fluids intravenously, a practice unavailable until near the end of the century, death came from dehydration. While adults might survive these maladies, they almost always proved fatal to infants and small children. Doctors also dealt with accident-related injuries, cuts, broken bones, burns, and bruises that we would not consider life-threatening. However, in the absence of penicillin and other antibiotics, any infection could prove to be fatal. Childbirth was another danger. Postpartum infection was a constant threat to young mothers, and infants who today could be saved through modern technology were often lost. As a result, young women married early, had lots of children, in hopes that 6 or 7 might survive to help them out on the farm. Despite all the shortcomings of the medical profession's ability to treat all of these ailments, one thing is clear: communities with a doctor were generally better off than those without.